acetaminophen, acetaminophen.
1. Uses. Treats many conditions like headache, muscle aches, arthritis, backache, toothaches, colds, and fevers. Can also reduce pain and fever. Point 2. Warnings. Overdose causes severe liver damage. Limit alcohol intake when taking this medication. 3. Dosage. Varies from 325 mg to 1000 mg depending on condition. Taken orally every 4 to 6 hours as needed. Maximum 4000 mg daily. 4. Side effects. Nausea, vomiting, stomach pain. Less commonly, rash hives, itching, liver toxicity. 5. Interactions. Increases toxicity when combined with zidovudine or other hepatotoxic meds like statins. May impact effects of anticoagulants like warfarin.
Aspirin, aspirin.
Uses. Discusses conditions aspirin is used to treat, such as pain, fever, inflammation, and prevention of heart attacks and strokes. Warnings. Covers safety warnings regarding risks like Reyes syndrome, asthma attacks, ulcers, bleeding events, and allergic reactions. Dosage. Provides dosage recommendations for aspirin based on condition being treated and patient factors. Side effects. Outlines potential mild to serious side effects of taking aspirin such as stomach pain, heartburn, dizziness, and ringing in the ears. Interactions. Discusses interactions with drugs like blood thinners, diabetes medications, diuretics, methotrexate, and NSAIDs.
Albuterol. Albuterol.
1. Uses. To prevent and treat wheezing, shortness of breath and breathing difficulties caused by asthma, chronic obstructive pulmonary disease, COPD, and other lung diseases. Point 2. Warnings. Not for acute asthma attacks. Use only with a nebulizer or inhaler, not injections. May cause serious heart problems. 3. Dosage. 2 puffs every 4 to 6 hours as needed, inhaled by mouth. Dosage for nebulizer solution is 2.5 mg 3 times a day. 4. Side effects. Nervousness, shaking, fast heartbeat, headache, throat irritation, upset stomach. Serious side effects may include chest pain, tightness, severe dizziness, allergic reactions. 5. Interactions. Increased effects of beta blockers like metoprolol. Decreased effectiveness of diuretics. Increased ECG changes with digoxin and monoamine oxidase inhibitors.
Allopurinol. Allopurinol.
1. Uses. Used to treat gout and high uric acid levels by lowering production of uric acid. Point 2. Warnings. Can cause serious allergic skin reactions and liver toxicity. Use with caution in kidney impairment. 3. Dosage. Start at 100 mg per day. May increase gradually up to 800 mg daily based on uric acid levels. 4. Side effects. Rash, nausea, diarrhea, dizziness, headache. 5. Interactions. Increased effect with anticoagulants like warfarin. Risk of kidney stones with uricosuric agents like probenecid. May need reduced thiopurine dose if used together.
Alprazolam. Alprazolam.
1. Uses. Used to treat anxiety disorders, panic disorder, and anxiety caused by depression. Point 2. Warnings. Has a high potential for dependence and addiction. Increased risk of respiratory depression, impaired coordination and accidents. 3. Dosage. Initial dose is 0.25 to 0.5 mg taken 3 times per day. Maximum daily dose is 4 mg. 4. Side effects. Drowsiness, dizziness, weakness, slurred speech, headaches, nausea, vomiting. 5. Interactions. Opioids, antidepressants, sleep medications and alcohol can all increase CNS and respiratory depression. Medications that inhibit CYP3A4 can decrease alprazolam metabolism.
Amlodipine. Amlodipine.
1. Uses. To treat high blood pressure, hypertension, and coronary artery disease, prevent chest pain, angina. Also used to treat other heart, blood vessel conditions. Point 2. Warnings. May cause severe low blood pressure, especially in dehydrated patients with heart failure. Use caution if you have liver disease, aortic stenosis, or coronary artery disease. 3. Dosage. Initial dose is 2.5 to 5 mg orally once daily. Dose can be increased by 2.5 to 5 mg every 7 to 14 days up to 10 mg per day if needed. 4. Side effects. Swelling of the ankles, feet, tiredness, dizziness, flushing, warmth, redness, or tingly feeling, nausea, stomach pain. 5. Interactions. Increased risk of low blood pressure with alcohol, alpha blockers, HIV protease inhibitors. Increased risk of swelling in multiple myeloma. Decreased effects of simvastatin. Increased side effects of cyclosporin.
Amoxicillin. Amoxicillin.
1. Uses. Infections that amoxicillin treats, including bronchitis, pneumonia, tonsillitis, ear infections, skin infections, urinary tract infections, UTIs, gonorrhea. 2. Warnings. Safety warnings about allergic reactions, diarrhea, mononucleosis risks. 3. Dosage. Adult and pediatric dosing information, typical length of treatment, overdose signs. 4. Side effects. Common side effects like nausea, vomiting, diarrhea, yeast infections, and less common serious reactions. 5. Interactions. Drugs with potentially significant interactions including probenecid, birth control pills, methotrexate, blood thinners, and drug products with aluminum or magnesium.
Amphetamine. Amphetamine.
1. Uses. Treats ADHD and narcolepsy to improve focus, attention, behavior control. Rarely used for weight loss or depression. 2. Warnings. High potential for misuse and addiction. Can cause dangerous effects on the heart and mental health, especially at high doses. Use caution if you have heart problems, high blood pressure, glaucoma, or bipolar disorder. 3. Dosage. Typically starts at lowest effective dose, 2.5 to 10 mg daily for adults, 2.5 to 5 mg for kids over 6, adjusted up to 40 mg daily. Taken 1 to 3 times per day. 4. Side effects. Agitation, anxiety, insomnia, trouble sleeping, headaches and stomach pain, diarrhea, nausea, vomiting, increased heart rate. 5. Interactions. Dangerous interactions with MAOIs. Impacts effects of antidepressants and blood thinners. Avoid alcohol and cold medications while taking.
Apixaban. Apixaban.
1. Uses. Anticoagulant used to treat and prevent deep vein thrombosis, pulmonary embolism, and prevent stroke in atrial fibrillation. 2. Warnings. Can cause serious bleeding. Not recommended in patients with prosthetic heart valves. Use caution in kidney or liver impairment. 3. Dosage. For atrial fibrillation 5 mg twice daily. For DVT treatment, initially 10 mg twice per day for 7 days. 4. Side effects. Bleeding, bruising, nausea, anemia, rash, low blood pressure, joint pain. 5. Interactions. Avoid use with strong inhibitors and inducers of CYP3A4 and PGP. Increased bleeding risk with NSAIDs, platelet inhibitors, SSRIs, SNRIs.
Atenolol. Atenolol.
1. Uses. Treatment of high blood pressure, heart pain, angina, irregular heart rhythms, heart attack. 2. Warnings. May aggravate heart failure and worsen symptoms such as shortness of breath. 3. Dosage. 25 to 100 mg once daily or in divided doses. 4. Side effects. Fatigue, dizziness, diarrhea, nausea, depression, shortness of breath. 5. Interactions. NSAIDs, calcium channel blockers, clonidine, reserpine.
Atorvastatin. Atorvastatin.
1. Uses. To lower bad cholesterol and triglycerides in the blood. It may also increase good cholesterol. Helps prevent blood vessel and heart problems. Point 2. Warnings. Liver problems have occurred. Call doctor if you experience unexplained muscle pain or weakness, loss of appetite, dark urine, yellowing of skin or eyes. Use alcohol cautiously. 3. Dosage. Range is 10 to 80 mg orally once daily. Maximum dose is 80 mg per day. Dose selection should be tailored to patient. 4. Side effects. Muscle and joint pain, digestive issues like gas and stomach pain. Serious side effects involve liver problems and muscle tissue breakdown. 5. Interactions. Increased risk of myopathy with gemfibrozil, cyclosporin, clarithromycin, itraconazole. May affect plasma concentrations of rifampin, digoxin, oral contraceptives.